doctors suffer the highest rate of suicide among all professions in the United States, or that 2/3 of all physicians experienced burnout and fatigue last year. Even before the COVID pandemic, doctors were overworked, mentally, physically, and emotionally exhausted to the point of breakdown. Progressive organizations like ours, CPA, the California Progressive Alliance, have made universal health care, aka also known as single payer coverage, a major part of our mission. Yet many advocates for a more just healthcare system often forget about the state of our doctors and physicians. My name is Ernesto Arce. I'm producer of All Things Considered for Southern California Public Radio. I'm also the former news director at Pacifica Radio KPFK in Los Angeles. I'll be moderating this panel discussion, and we have some amazing guests tonight. I'm joined by an incredible panel of healthcare professionals who know about this startling issue from a very personal place. Jeanna Harris is a clinical case manager who advocates for single-payer healthcare while also sitting on the California Democratic Central Committee. Dr. Pamela Weibel is a family physician who has written extensively about the hidden suffering that leads to physician suicide. She actually maintains a doctor suicide registry with over 1,700 cases. And Amrita Jamu is a fourth-year student at Kirksville College of Osteopathic Medicine who is committed to advocacy work for underserved populations where she hopes to practice. She's also a member of our steering committee. Let's start. I want each of you to paint a picture for us, if you will, about the realities of working as a healthcare professional within the current U.S. healthcare system. We can start with you, Jeanna Harris.
Oh, sure. So, wow. I could start by just saying that there's just a massive corporatization of healthcare that is moving us from a compassion care model to more of a metric driven, which there's not an issue with data. But when you have our leadership driving, just to meet data goals and whatever satisfies the spreadsheet and not focusing on patient care, it is driving us into a state of compassion fatigue, trying to basically be pulled apart. One is to meet metrics. The other one is to take care of our patients. That's what we all came here for. So I would say that corporatization of healthcare has been driving us into this kind of darker healthcare world that is, more profit-driven than care-driven.
Dr. Pamela Weibel, I know you've written extensively about so many of these issues. Maybe you can add something to what Jeanna just mentioned.
Yeah, Jeanna pretty much nailed it. When you have a lot of third parties that are for-profit inserting themselves between the doctor and the patient, you're going to have the relationship breakdown that's going to create poor health care and a lot of physicians wanting to flee the profession. So I pioneered something that I think is really helpful, which is community-designed ideal clinics, where I did a series of town hall meetings about 16 years ago and allowed my patients to design their own clinic, the first one in the country designed entirely by patients. And it was completely awesome. I retired last year, but for 16 years in private practice in a clinic that was designed completely by patients, I served them. And it was an example of what I call relationship-driven healthcare. There's a lot of relationship-driven healthcare models out there, direct primary care models where there is direct payment from the, patient to the physician. All unnecessary third parties have been removed because these third parties that want to insert themselves in between the patient and the health professional are sucking down a lot of money, time, energy, and they have nothing to contribute except walking around with clipboards and kind of batting people around, pushing them to move into this production-driven, volume-based model, which is not what we need. We need a relationship-driven model, and that should be designed at the community level without intrusion from third parties, including government, should get out of the way as well. This should be directly between the healers and the people needing health care. And I think that can be easily constructed by people that really care, like the people here on this panel obviously care about their communities. And we need to have basically it's called disintermediation, removal of the middleman, essentially.
Amrita, we've already heard several phrases like compassion fatigue, the corporatization of our healthcare. What might you want to add as a current student who will soon be, getting into this profession?
Yeah, I would say as a student, I mean, they're echoing basically everything that I've seen during my last few years of medical school. I would say the reality of what we are expected to provide in medical school versus the reality when we get out and practice, it's unrealistic. In medical school, we're taught, of course, to have compassion, to have time to listen to your patient. And yet, again, we're siloed in terms of providing care for only 15 minutes and not addressing all of the concerns that patients need. And at the same time, we are also getting reviewed by patients too. And so there's this never-ending cycle of trying to provide quality care, but also having, again, these third-party systems that are dictating, I mean, not even just insurance, but we're talking about, healthcare administrators, et cetera, that are dictating the type of care we're providing. And then we're also getting backlash, right? Trying to follow these rules from our patients who think we are just not compassionate or we don't care, when truly it's the system that is molding us into really I would say a robotic, streamlined type of management of care. And I mean, as a medical student, soon to be family physician, doctor, that is not why I joined medicine. And I don't think anybody here on this panel in health or in healthcare in general joined in order to be a part of a streamlined a streamlined conveyor belt of parsing out medical care. So I would say there's definitely this unrealistic expectation of what we're supposed to provide and what we can provide at this point in time, given our current medical system.
And
One thing
unlike,
I just want to add really quick
Sure.
with what Rita said that I think really captures the essence of the problem is a term called assembly line medicine. And that's what I feel like we're all trapped in, patients, all health professionals. We are on assembly lines, feeling like factory workers, patients feel like widgets, and we really need to break out of this assembly line medicine type of healthcare because it just doesn't work. It's failed.
And Dr. Weibel, I would like you to expand a little bit on the idea of patient centered, or actually the idea that patients actually created their own clinics and said, this is what works best for us. This is what's most responsive for us as patients. I would like for you to talk a little bit more about that. But first, I did want to paint a picture of the U.S. healthcare system, as some YouTube viewers who will watch this might not know about. The U.S. system is very, very much privatized, unlike systems like, let's say, in the UK, where they have the National Healthcare Service, the NHS. Things are a bit different here. They're, especially hearing you mention the corporatization of the American healthcare system. You just mentioned the assembly line medicine approach to healthcare. Everything is seemingly about profit. Everything is seemingly about turning the corporate model, turning the healthcare model into a for-profit corporate model. I know this pretty personally. My sister is a registered nurse for the Kaiser Permanente corporation, if you want to put it that way. And she rarely has a slow day. She rarely has a restful weekend, for example. She's constantly thinking about her patients, constantly thinking about her workload. What does this for-profit, and I'm going to veer from some of the questions that I had prepared, but what does this privatized for-profit healthcare system really do? Not just to patients, but to physicians as well. If we can start with Jeanna.
If I could add to that, because in my role as and as a nurse, like a case manager, I deal with this insurance world. And I mean, 20 minutes ago, I just walked in from work myself, and I'm only supposed to work, 10-hour days, but I was there almost 11. Mm-hmm. And why I was there was to help my patients. And that's completely extra. And it was to try and get a patient started under chemotherapy at my hospital where she wanted to be, where we could do it, but she doesn't have the right insurance. Her insurance is not capitated to my hospital. And to start treatment like that, we would need to make sure she would be able to follow up with us outpatient. And right now she cannot because her insurance. So my poor patient who has cancer, who just found out about this cancer, we know what it is. We know we have a treatment plan ready to go. But we cannot initiate it because she switched her insurance. Thankfully, she went ahead and switched it, but there's a 3-week lag time. So for 3 weeks, this patient's going to sit at home, knowing she has cancer, knowing she needs chemo, and won't be able to start it. If she goes to her in-network oncologist, they're going to know that she just switched her insurance, and they're not going to start anything either, because they're going to be like, well, you can't follow up with us either because you're going to be switching to this other place. So now for 3 weeks, she's going to sit at home. And that was what I was doing only a few hours ago. And so when I say the privatization, corporatization of healthcare, it really is killing people. And I'm delaying treatment by 3 weeks, just waiting for a system to update.
Dr. Weibel, maybe if you can join the discussion in regards to that corporate model and how, so many doctors and physicians are embroiled in this, in this, if you want to call it bureaucracy or I stopped to think about my experiences with the healthcare system. I am privileged to be part of a journalistic industry that still has a pretty fair union bargaining unit, so we get pretty good insurance. But I know my primary care physician several times asked me while I was dealing with a health issue. He's like, "Do you mind coming in for a third visit this week?" They were going to do an MRI on me, and they said, I know it's a financial concern for a lot of clients, a lot of patients. So I just want to make sure that I can schedule you for a third appointment this week. And so he was mentioning that there's just so many patients that cannot afford multiple visits within a month because their deductible is too high and their copay is too high. How does this weigh on doctors, Dr. Weibel? How does this weigh on their ability to do the profession that they love and that they wanted to do?
Well, again, when you have no value-added intermediaries inserting themselves for profit in between the health professional and the patient, you're going to have a decimation of the ability for us to provide real healing services for people. So, and I just want to preface this with the fact that I don't have any trouble with for-profit corporations. I think the problem is because, let's just face it, none of us would be here if we didn't make a profit, and we have to all pay for our electricity, our food. Like, there's nothing wrong with making a profit. I think there's something wrong with making an unethical profit. There's something wrong with extreme divergent levels of income between the top tier and the lower tier. And so when you have unethical people at the helm, and this can be because I'm dealing with a physician suicide crisis. And by the way, I run a free suicide helpline internationally. I'm talking to doctors in Poland, Germany, UK, India. I sort of know, like, just because you have, one size fits all health insurance model or health system, that doesn't necessarily weed out the unethical element. So I think really what we need is a deep soul searching. I feel like any model could work if we have ethical people at the helm. The problem is we have too many ethical people making a nice passive income off of our blood, sweat, and tears as actual healers, and they're not contributing anything. So what I did, because by the way, this drove me to almost die by suicide. Both my parents are physicians. I've wanted to be a physician ever since I was young. I used to tag along to work with them in the 1970s, so I saw what real healthcare was like before this massive intrusion of more and more third parties wanting to make a nice profit off of us. I went on house calls with my parents and went to the morgue with my dad as a medical examiner, went to state hospitals and saw psych patients. I did all this like before grade school even. And so all I wanted to do when I became suicidal after 6 jobs in 10 years that all felt like I was on an assembly line, I was literally like, what's the point of being a doctor? If I can't be a doctor, like, why am I even breathing? Why am I even alive? A lot of us, this is different than real estate or banking. This is a soul's calling for people that choose to be healers. And when we're not allowed to be healers, we feel like we're in a straitjacket because third parties have suffocated our ability to actually provide care. It's a nightmare. So the way I sort of came out of this, I had a prophetic dream that woke me up from 6 weeks of laying in bed being suicidal. And I had this revelation that, like, why am I waiting for other people to solve this crisis? You know, why would I wait for, say, Obama or whomever to come to town to do a town hall meeting and ask people what they want and then go back to Washington, D.C. and then tell me what I'm supposed to do? Like, why don't I just cut out all this government BS, for lack of a better word, and all these third parties and just literally do a town hall meeting in my town and ask people what they want? So I did that, led a series of town hall meetings back in 2004, and I got 100 pages of written testimony from the people in my town. I pretty much asked them, like, design your ideal clinic. I'll do whatever you want as long as it's basically legal. And they told me what they wanted, and we opened 1 month later, adopting 90% of what they wanted with no outside funding. And it was a model for hundreds of, it's still a model. I'm teaching physicians all around the country to launch these community design clinics. And I think it's an example of giving autonomy and power back to the healer to do their job, and also allowing patients to truly take a collaborative approach and have a patient-centered practice. I don't know of any other practice model in the country where patients designed the entire clinic, set it up, I mean, down to the color on the wall, the couch, the organization, the pricing, the fact that they could have house calls. I mean, they just designed the whole thing. And I think if we would just, again, cut out these unnecessary parties and get right back as a healer with the people that we want to serve, we could do the same thing all around the country. Because most people, by the way, what they need is very simple. They don't really need hospital-based care. The reason why people end up with all these out-of-control health issues that require third-party care is they didn't get the primary care that they needed to begin with. They didn't get the healing food, the healing, the time with their we're just basically putting Band-Aids on disasters all day long, churning people through, not really healing them. A lot of people don't need as many MRI, CTs, tests, lab tests. What they need is time. I don't know if you're familiar with this quote, and then I will summarize here. The quote is something along the lines of, the role of the doctor is to listen to the patient. If you listen long enough, the patient will tell you their diagnosis, and they'll even sort of help you with the treatment plan. Like, the point is, because we're only given 7-minute visits with patients in these assembly line clinics, it spawns this need to, like, throw pills, tests, labs at people so you feel like you're doing something. And we're literally I feel like we're creating more havoc and problems for people than actually solving their medical crises.
Amarita, thank you for that, Dr. Weibel. Amarita, maybe you can add to, or maybe I can ask you this question about that assembly line approach to clinics and to treatment and to healthcare in general. Is that what you had envisioned when you decided to get into this field? And hearing your colleagues, your colleagues say this, is it surprising in any way? Is it shocking? Is it disappointing?
I mean, that's a great question. I would say, I think, as I mentioned before, people who want to do medicine, their souls are into it. They want to make a difference, and they want to make this impact that they envision on their patients. And the harsh reality, and it's something that I talk about with my colleagues too, we always ask ourselves, would we do this again? Or what would we tell people who are wanting to pursue medicine? And it is this ugly truth of that, the fact that everyone says, oh, as a physician, you're your own boss. And looking at, mentors that I've worked with and clinicians that have worked for a long time in this corporate system, you aren't your own boss. And it is it's a painful pill to swallow, because at the end, we go through such a grueling process. And I can't stress that enough. And I always try to educate people who aren't in medicine, but the amount of training we go through, the amount of debt we're in, and that's a whole other discussion too, as well as going through additional training and residency where you're paid minimum wage, if that, for working, 80 hours plus. It's disheartening. And that's definitely something to where I know that it's a reality, and it's people like Dr. Weibel, like Jeanna, where we kind of have to band together and really advocate for our rights in this field, because at the end of the day, Dr. Weibel said it best, and I've said this to all my colleagues, nobody is going to do that for us. And so it's why we have to, as a collective unit, advocate for ourselves and advocate, on Capitol Hill, go and because again, the federal government, they're not not going to do anything. It's up to us. And so I would just echoing what Dr. Weibel is saying, it's a harsh reality, but the reason why I'm still doing this is because, again, it's people like on this panel that I believe that we can fight for some justice. And also, Dr. Weibel, I'd love to work in a clinic like that. So.
I'm happy to train anyone. Just by the way, anyone who wants to open their own clinic, it's very easy. You can be your own boss. I was even accepting insurance and had no problem serving my patients, but I was also doing cash pay. I was also seeing people that lived out in the woods and without houses. Like, I was able to basically, I want to say, in 15 years of being self-employed, or close to 16, I never turned anyone away for lack of money in a patient designed clinic that was first in the country, and then helping thousands of other doctors be aware that this model exists, and hundreds launch similar practices around the country, including nurses. I want to say I've helped nurses launch in their own practices, and all sorts of healers. And I think it seems pretty obvious to me that we're going to have to grassroots it here and really just take back our power and help heal our communities. The infrastructure is failing us. We've got a lot of unethical people in power positions here, there, and everywhere. And all we can really do is look in the mirror and do the best thing we can do with ourselves each day and serve the people in front of us. And the sooner we can sort of boycott even having relationships with these unethical people in unethical government positions and unethical, corporations, I just want to empower people to know, like, you can provide healthcare right away. And even if I've helped even medical students who haven't graduated from medical school launch coaching practices and get paid for helping people heal. You do not have to wait for 1 million diplomas to come through. Anyone that needs help, please just reach out to me, idealmedicalcare.org, or you could Google Pamela Weibel, contact, and I will help you for free get going and start healing your community.
Yeah, that's an incredible statement to make, and I think the idea is absolutely fabulous. When it comes to ideas like this, the big challenge is always, how do we, if it's an idea that works, if it's an idea that is embraced by patients, like it sounds like, how can we incorporate this across society? And it's always the same question about, for example, the charter school versus public school debate, where public schools are woefully underfunded. Charter schools are so select, but they work very well because it's a very efficient model of a smaller class size. So it's always the charter school advocates saying, hey, we finally found a model that works. Now the question is, how do we make it accessible to all? And I don't know if you have any ideas about this, Jeanna, in regards to when there are models that work, how can we make this universal so that we do ease some of the pressures and the burnout that's being faced by physicians?
As Dr. Weibel said, take the middleman out, connect the care back to the patient. But going back to what you said about like public schools and charters, you have like public insurance and you have, private. What's happening is, I call it a double dip. I use Medicare Part C, since, and to caveat, I used to actually be in management. So I actually know that brutal operational world. And that's what I was just like, oh, heck no, I'm out of here. But Medicare is Part C, you're seeing it. Medicare open enrollment's going on right now. For those of you who are over 65, you have open enrollment going on right now. And you're seeing a ton of commercials, Medicare Part C, Medicare Advantage, Medicare Advantage, Medicare Advantage, all these health plans, Anthem, United Healthcare, all these people or plans are advertising right now to get you to enroll in their program. And the first thing they say is, we offer more benefits than Medicare A and B. That is the original Medicare that came into life in 1965. Partially due to the civil rights movement, just add that out there. But Medicare Part C is what I call a double dip. And I think that a lot of private schools do a double dip too, because they get still some type of funding from public, whether they, they wiggle their way into grants and things like that, that could have been going to public institutions. Those class sizes can be just as small in a public institution if the money wasn't being split 50 different ways. Same thing with Medicare Advantage. These health plans, they get all this employer sponsored money, right? These are the ones, your Anthems and things like that. Everyone who has a job with full benefits has some type of, insurance, Cigna, blah, blahs. But now they're coming into the public money. And now they're dipping again into this public money and saying, okay, I get your employer money and I get your public money. And, and then like, we're just constantly funneling it over. So now they're saying they're offering more benefits, but they're now throttling that care through utilization management. With Medicare, you meet criteria, you meet the guidelines. Okay, cool. Their refund reimbursement and all that's a little bit slower, but it's guaranteed if you meet the criteria. Whereas with Medicare Advantage, you have to go through utilization review. So now you have that third party adding into this. They're reviewing things. And well, my medical director felt like this should not have been done at this level of care. Well, the patient was kind of sick. So, we kept them at this level of care because, they had a really bad event a few days ago. We didn't want to downgrade them right away. And so now I have to take a doctor off of my floor and say, hey, can you call this insurance company to talk to this medical director who just read a note who thinks that we didn't do the appropriate care to be paid at the level. And so I've taken that doctor from seeing the patients, and now I have to go put him on the phone to chase a tail to talk to a medical director. And now that's the throttling of care. My patient who can't get chemo started right away, the throttling of care, thanks to these third party, this utilization management, all because they wanted to dip into the public funds. Now, my patient that if she would have had just like non-health plan related insurance, that would have been, that would have been covered. She would be starting her chemo treatment. But because she has a health plan or, a medical group associated to it, we have a delay. Double dip. They get paid either way.
Yeah, and I knew when we started this conversation, we would eventually be talking about the failures of our private healthcare system and veering away a little bit from the issue of physicians being absolutely burned out. But maybe we can get back to that discussion. And Amrita, I wanted to ask you about being that you're still a student, yet I'm sure you're doing residence in different places. But how will transformative changes to our healthcare industry, namely things like universal healthcare, right the wrongs for both doctors and their patients of our currently broken system?
I mean, I think it's, again, what we've been saying. I think if this were to be implemented, I think it would just put the morale, honestly, back in the medical community of why we're doing what we're doing. Again, going back to the lack of autonomy that physicians end up having, that truly a lot of people don't realize once they're so far in medical school. And then also, unlike other countries where, say, maybe you're like, oh, okay, maybe this isn't right for me. Too late. You're in already hundreds, thousands of dollars of debt. And so how are you going to pay that off? And, the other unfortunate thing, and I talked to, and it is an unfortunate reality, but a lot of medical students choose their specialties based on what their ultimate income is going to be so they can pay off those loans. So it's also, again, shifting away from that model of I'm doing medicine because I truly want to do it versus I'm doing medicine because, but I'm going a specific type of direction because it's going to pay for all of these loans, all of this, extra financial burden that now I have accrued in order for me to just live a normal life. I wouldn't even say an above decent life. And that's the other thing that I kind of want to stress to viewers, and I educate people too, is I go to a lot of, I just go to a random place and I tell them, oh, I'm going to be a physician. They're like, oh, you're going to be set. You're going to make, you're going to, and I just kind of laugh. I'm like, really, you think so? So, and then I tell them, I'm in like over $300,000 of debt and I still have all this training to go and I'm going to be working like a dog for, 3+ years. And even after that, it's, you don't live this cushy lifestyle that people think you do. And again, I think that goes back to why, again, it's profit over people. And it's also making physicians have to choose that too, because we also have to live at the end as well. And we've given up so much of our time, our energy, into this. And so, and then again, I think for the patient's aspect as well, it creates this, or it resolves this siloed care of, having this, of basically being able to use the authority of your training to treat the patient how you want to, not how anybody else is telling you to do that. No insurance company, no third party entity. It's how you want to, and not going through these extra hoops because this person who has no medical training at all is telling you that they're not going to approve some type of medication or some type of x-ray or whatever it is, because again, it's just not profitable for them. So I definitely think it would just boost the morale and honestly kind of shift focus, I believe, into investing more into primary care, which is also what our country is lacking, I think, as well. We're very focused on the chronic aspect of medicine, and the specialized focus of medicine for the financial reasons I mentioned. But also, again, there's just not enough priority in that. And if physicians were given a choice and this system was restructured, I do believe that our society could be so much healthier. And again, we would have a robust primary care model that focuses on preventative care, not chronic treatment.
Dr. Weibel, it sounds like you have a potential solution in the patient-created clinics that you spoke about. Are the doctors and the nurses that are taking part in this experiment or in this new path to healthcare, are they happy? Are they generally?
Yeah,
Go ahead.
They're really, really happy, and I think that, and some of them actually have told me that this has saved their lives. Meaning that they were also thinking of either giving up their career or potentially killing themselves. They've had passive suicidal thoughts, which is really common among health professionals. Just kind of thinking, oh man, what if I just turn my car steering wheel? I can get out of all this mess that I'm in. It's just demoralizing to be in the situation where you're in so much debt, you're in survival mode, you're vicariously traumatized every day from things that you're seeing, and patients are dying. And I think it's pretty obvious during the pandemic what the situation is with our healthcare institutions. And so I do want to share on the positive side 2 little stories. One is you were wondering, how do you take a model like this and basically scale it? It was really cool. A hospital CEO contacted me several years ago, and we did this in a hospital system. We basically did a community designed hospital, scaling the exact thing that I did with my clinics. And I went and did 13 town hall meetings in 48 hours in this town in Wisconsin. And we redesigned the hospital according to what the community wanted. And it was amazing. But let me tell you what thwarted this whole thing. Somebody higher up in the CEO got wind of it and kind of liked things as they were with the power structure and the hierarchy, and literally fired the CEO over me. And then I outlasted him on the executive team of this hospital. That's how threatened some of these people are with changing this rigid hierarchy with unethical people making a high passive income at the helm. You have really good CEOs and really good people in management, obviously Jeanna and others, that really care, right? But they're thwarted in being able to really make the changes they want because of just a few unethical people at the helm. But I want to share the value of relationships, even with all these, people that we wish would disappear, so we could really take back for the people health system. I want to share an example of the value of direct relationships. It's not just the value of me having time to do a house call with a guy who lives in the woods with an outhouse and give him top tier VIP care, even though he only can pay $20 per visit. I give people VIP VIP care, no matter what their income, no matter how rich or poor they are, they all get the same thing for me. I go overboard for everyone. And it's really fun, and you can sleep at night, by the way, that way, because you're like just on task with everyone, and it's great. So, but one thing I want to share is I had, similar to Jeanna's issue, where you have an insurance company thwarting your ability to get a patient's needs met. I had this woman, I think it was pretty much like she needed cardiac advanced testing, had to be sent to a cardiologist, had a plan where it was, she needed a female cardiologist too, because she had sexual abuse in the past and didn't want like kind of the male cardiologist. She had trouble with male doctors because of some childhood wounds and other stuff, right? And I was like, oh man, I'm going to have to get this like prior authorization. I'm going to have to find, there's hardly any female cardiologists. I'm like, I found one that I wanted her to see. And I was like, man, I'm going to have to work some magic to get this to happen. And what I did, because I had to, you have to fax over like the referral request, and you have to like wait like for wherever it's going to go. You know what I did? Back then, I didn't even own a car. I was doing house calls on my bike and everything. I rode my bike, with my bike helmet and my little doctor with the referral, and I went to the building where the fax machine would have received this, and I like went to the front desk and I was like, hey, I'm a human fax, here I am delivering instead of waiting for machines to kind of process all this. I was like, who would this fax, show me the machine that this fax would like come off of, and who would pick it up, and she took me into the back end of this place. I had to take a little badge, and ultimately I met the woman, this like blonde-haired sweet woman that was in a little cubicle, and she was the one that was going to make the decision. And I just sat down next to her in my bike helmet with the fax, and I was like, hey, this is the issue, da 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 da. And I said, what button do you have to press to make this work? And she pressed the button, and voila, we were done. So this is just an example of, if you can get these no value added people out of the way, like even the cubicle workers and some of these insurance companies, they really care, and all they need to know is to have a direct relationship with you, understand what's really going on with your patient, and they will get your needs met right away. It's because we have all these obstacles of like something that could be an A to B approach becomes like a spaghetti maze, and and they're doing that on purpose because they want to wear you out with so many obstacles that you stop advocating for yourself or your patient.
Thank you so much for that, Dr. Weibel. Jeanna, I want to leave you with perhaps the last word, if no one else has any closing statements or closing advice that they want to give us in regards to where the healthcare industry goes from here, given the absolutely untenable situation of our physicians and our doctors. But maybe you can tell me a little bit about what's the next step. What's the how do we as a society improve our healthcare system? How do we improve the lives of our doctors and physicians? How do we stop this GoFundMe of look, our patients have no other options to pay for their absolutely essential healthcare than to go to their friends and relatives, neighbors, colleagues, and coworkers to pay for these expensive medical treatments? How do we deal with the exacerbated healthcare professionals that are absolutely done with pandemic X, Y, and Z, and every iteration and every variant of these different viruses? How do we get to a higher place?
Well, the first thing is that we have to come together as a community. We are so individual, we're so, well, sucks to be you type people. We have to come together as a community and know that we hurt together and we also heal together. We have to not just look at, oh, well, I'm Black, so I'm going to talk to the Black community. No, I'm talking to every community. We have to look after each other. There are so many factors that are outside of healthcare contributing to why we are busting at the seams and are in these critical capacity hospitals. Environmental, issues, I think contribute to a lot of cancer diagnosis we see. And so we have to really first look at ourselves, and then also how can we make ourselves healthy? Yes, you need to drink water. Yes, water matters. But if you don't have clean water, What if you were in Jackson, Mississippi? What if you were in Flint, Michigan? How could I say drink water when your water is not clean? So we have to hold accountable the people who said that they would take care of us, the people who came to us and said, hey, will you vote for me because I'm going to make your water clean and our water isn't clean. We have to hold them accountable, not to get political, but you did say I am in politics. But we have to get political, and we do have to vote these people out, no matter how many times we see their commercials, no matter how many times they shake our hands. If your water isn't clean and that person promised you clean water, it's time for them to go. If that person promised you that you would have a better healthcare system, but then you saw that they voted against said healthcare system, they've got to go. So that's where we need to go right now. But also, we also have to go as, looking at ourselves as nurses and doctors, looking out for each other too. A lot of times you'll see that there might be some like head to head against nurses and doctors. What I do right now puts me right next to like the intern. So people like Moderator, as soon as she graduates, she might come in and meet somebody like me. And instead of me just grilling you and throwing you to the wolves, I'm here to help you. I'm here to guide you through this system. Now, if you don't listen to me, that's on you. But, I'm here to also be there for you. And, prior to this starting, we had talked about, physicians and resident unions, right? I also am I represent my coworkers in a union, and where she was mentioning how great it is to see that, the residents are unionizing. Absolutely. But one of the things I told to my residents about union is that you strike, I strike. We're together. So collective bargaining is going to be huge on breaking down these terrible systems driven by people who haven't even touched a patient in 30 years. So that's another thing. So outside as a community, a bigger community, we have to look out for each other. But in our close-knit community, nurses, doctors, and all healthcare workers, we have to look out for each other, supporting each other, treating each other with respect and dignity, knowing that we are all struggling, not just because we've been dealing with pandemic, the COVID pandemic, but also knowing that we've dealt with a lot of racism. We're being onslaughted by what's going on in our world. So people are having bad days. Give each other a hug. That helps. That's my 2 cents.
Hey, give each other a hug. That's a perfect way to end this segment. I want to thank you all so much for being part of this panel discussion on physicians and the burnout that physicians are dealing with. Hosted by CPA, the California Progressive Alliance. Thank you all so much. And if no one else has any other comments, we can go ahead and conclude here.
Well, one simple thing I'll just say that when Amrita asked me to be on this panel, she wanted to know, what were the top 3 things I would recommend that would really change the landscape here. And number 1 is we need labor law protection. There's no reason why physicians should be working 28-hour shifts, 80-hour work weeks. That's dangerous for them. They could get in a car wreck on the way home. Why would they be driving? Why would they be in the ICU if they're the equivalent of they've got the psychomotor retardation equivalent of a DUI? They should not be in the ICU running codes and all of that. So that's number 1. If we're looking at, how can government help us? It's we should be protected so that we're not impaired by our working hours. We need labor law, the same labor laws that protect everyone else in California, say. And the other thing is these mental health questions on medical licensing and nursing licensing applications. They're very invasive, and they prevent us from receiving the mental health care that we need because they feel like we're going to lose our license if we answer yes, that we have depression. Who wouldn't have depression in the system? We're all depressed, and we probably all have PTSD, but we all have to lie on our medical licensing and nursing licensing applications for fear that we'll lose our license if we admit it, which creates mental health stigma that drives people to their graves without adequate care. And the last thing I'm going to say is I really have a problem with this disinformation, misinformation policy that's going on in California. Nobody should ever be afraid to talk to their patient about anything, homeopathic remedy. I mean, it really makes you feel like you can't say things without getting turned in to the board. And that relationship between you and your patient is sacred. And you should never feel like an insurance company prevents you from discussing something on a formulary, or that your state is putting duct tape on your mouth to be able to say something that might help your patient. So those are the 3 things. We got to stop the censorship. We need labor law protection and stop the mental health discrimination on medical and nursing licensing applications. So that's it.
Thank you so much, Dr. Weibel. And I know that nurses have very powerful unions here in California. We have the CNA and National Union of Healthcare Workers, some great labor organizations that advocate for their workers and have won lots of great bargaining rights from the big healthcare providers. And I think it's time that doctors receive the same. And I know there might be an issue with doctors being managers, which might prevent them from having effective unions that fight for their rights. So that's absolutely an important aspect that one that progressive organizations should really pick up on. So thank you all so much again for joining this discussion, and have a great night and a great weekend.
Thank you.
Thank you.
Good to meet you all.